First of all, thank you all for coming. It's great to have some cooperation and collegiality between the trainers and the PTs are all working together to make athletes and Joe Bloggs in the street a better person and a better competitor and a better survivor of all the injuries they come and see us for. For those who don't know me, I'm Bruce Twaddle. I work here as an orthopaedic surgeon, and it gives me great pleasure to introduce Greta to you. Greta I've met when I visited Oslo, and going to the centre that they work out, and particularly the Olympic Training Centre, and seeing the research and the science and the thought and the constant self-analysis and criticism that goes into how they practice every day is an inspiration. So, and Lars, who's sitting quietly in the back, is another Norwegian legend, and he's clearly a Viking stock with his work ethic. And so he and Greta swap complicated patients with each other and have been working together for a very long time. So looking forward to Greta's presentation, and we've got a couple of patients that she's going to go through how she looks after and assesses and treats patients, so you can get some idea of the things she does. Greta, thank you.
Thank you very much. And thank you, Bruce, for inviting Lars and me. So far, the stay has been perfect. You are a perfect host, and I really enjoy Seattle. And it's more to come, I have understood. Maybe say a little bit more about myself. I'm a physical therapist, and I'm a specialist in sports physiotherapy. And in Norway, we don't have athletic trainers. So I have a feeling that I'm a combination of those two. We work a lot with the athletes, and we take care of the whole rehab, of the pre-hab and the rehab after the reconstructions or operation. So I think we will work quite the same. I have a feeling that we do more or less the same thing. Please stop me if there's something you want to ask, and if I'm not clear enough, since I don't speak fluent English, but I will do my best. So just stop me. I have over 20 years experience by traveling with national teams, and my favorite sport is a sport you probably don't know so well. It's European handball or team handball. I traveled a lot with handball, soccer, which we call football, but I can't do that here. Soccer, and have been traveling also 10 years for the beach volleyball national teams. So from working and having 15 to 20 athletes taken care of, I started with the beach volleyball, having 2 to 4 athletes. Very nice, and nice locations outside on the beach and things like that. So it had changed. This is handball. For those of you who haven't seen it, this is a typical ACL injury situation. Look at the left knee. And this is the cutting movement is the way they mainly injure their ACL. 67% of the injuries occurs in a cutting situation, almost like this. And tomorrow I will talk more about prevention, but of course, going into a cutting position that way, with that wide hip stance, is not wise. We'll come back to that. This is a sport you probably know much better, female soccer. And again, the girl, look at her right knee when you see it one more. Typical way the soccer player injured their ACL. We'll have it in a couple other angles. And you see she has a lot of pain and is probably very afraid. Quite straight knee and giving this pivot shift movement. Here is probably a sport you know even better. And an easy way to avoid this kind of injury is, of course, land on 2 legs with flexion hip and knee. So it's really important for all of this sport to practice in the rehab after an injury. Don't land like this. Don't do it so fancy. Okay. The ACL injury has a multidimensional impact on the individual, and I think the reduced knee function is obvious. There are psychological changes, and there are rehabilitation demands, and potential surgery treatment, because everyone is not reconstructed in Norway. I will come back to that. But when we are assessing the knee function, the aim is to capture the overall impact of the knee injury and the function. And we do that by using patient-reported outcome measures, to look at the performance-based outcome measures and the clinical outcome measures. I'll go through that. And some of the patient-reported outcome measures, we use AKDC, and we use the COOLS, you probably do the same, where we can get an objective number of how the function is. We use a lot hop test and agility test, and also muscle strength measurements. Probably do that same. And regarding the clinical outcome measures, we of course check the range of motion, looking at the joint diffusion and the laxity. And when we got an ACL injured patient, I always use a lot of time on the history. What are the patient's story? What happened? How did the injury occur? How long time is it? Is it yesterday, or is it a week, or maybe it's gone a longer time? And I use a lot of time to explain, and I use the knee model to tell them what an ACL injury actually are. Most of them don't know, even though they have been into the internet quite early. And often we use the seatbelt analogy. You probably do that yourself. That the ACL, we don't need it usually, but we need it if we don't need a seatbelt in 100 km/h, but we need it if something happens, then something has to stop the movement. So, and I think that's a way of thinking that the athletes understand that it's good to have when you're doing special movements in a high speed with rotation and cutting. And the treatment alternatives. In Norway, we actually only reconstruct half of the patients. Lars knows a lot about that because he has been in charge of the registry. And only 50% of the Norwegian ACL ruptures go into a reconstruction. How many are getting reconstructed in the US? All of them? Also, if you are 40 years and are just running and doing your, they go to reconstruction. Okay. Well, anyway, in both ways you need really good rehab and follow-up to get the knee stability. And it's really possible to get a good knee without reconstruction. And a lot of patients come to us and say, I want to have surgery because I want to be absolutely sure that I get 100%. And getting reconstruction is not, you're not sure that you will have a good knee, because getting an operation is the first thing that could go wrong. And the other thing is that if you don't do your homework or you do your exercises well, you can see patients with isokinetic testing like this, where the quadriceps function is really bad. And of course, you can't go back to any sport if you have this loss in quadriceps strength 6 months after reconstruction. So getting a reconstruction it gives you no guarantee. You have a lot of work to do to come there. So why is it important to start the rehabilitation early? We are really telling the patient that you need to start doing your exercises early and keep a hard work until you get reconstruction, because wait and see is never the correct treatment. So this is just between the treatments, you can do that. And don't keep the leg at rest while waiting. Do hard preoperative training. And we also try to teach the patients that what you are doing at the clinic, maybe 1 hour, 2 times a week, what about the rest of the hours during the day? So we have a 24/7 perspective. Be aware of the total load of the knee. Don't go to the matches and stand there and be happy. Go out after the match and have fun when you have a newly injury or reconstruction. And And the guidelines for the rehabilitation is being a sports PT or an athletic trainer to collaborate with the orthopedic surgeon. I think that's important because then you really know what you are allowed to do, if there are special cases around this person. So that gives the value for patients. And we also think about the rehabilitation in phases. I don't think this is new for you, but I will go through it anyway. And we try to have some functional milestones and do some functional tests. And of course, we need to individualize the rehab. Any patients are not the same, they are always different, and they are going back to different sports. The first preoperative phase is to optimize the knee function, get away the fluid, get the range of motion back, take care of the muscle. The acute phase to, again, minimize the fusion, eliminate pain, and increase range of motion. After a while, we start with progressive and functional exercises, and then we go to the more return to sport phase, where we do muscle strength training, power, sport-specific training, and neuromuscular training. And I think it's important not to forget phase 4, because if you go back to sport, you should do prevention. Really think about what is the right thing to do to avoid a new injury, because we see a lot of athletes coming back either with a re-injury or the opposite leg. So if we can do something to reduce that risk, I think that's good. And I won't go through this in detail, but this is the algorithm we are using, where in the beginning we use a lot of time to get a range of motion, and more neuromuscular training and strength along the way. So you probably recognize all of this stuff, but it's important to don't forget this one, secondary prevention. And the preoperative phase, get full extension, no effusion, and the quadriceps strength, 99% of the opposite leg. If you can do that, then we know research has shown that the rehab after the reconstruction is much easier. It's much easier to get the quadriceps strength if you really reach this. So we train the athletes preoperatively really hard. The acute phase, eliminate effusion and increase the range of motion and use the price or the police or what we call it now, it's many names. Try to reactivate the muscles, to active isometric exercises, and the use of neuromuscular electrical stimulation is more and more used among athletes who have trouble getting especially the vastus medialis. Do you use it a lot? With some patients? Yeah. And of course exercises for the core, hip, and ankle. And studies have shown that after a reconstruction, there are activation failure on the quadriceps in 30% in the involved side, and also 30% of the patient had inhibition on the uninvolved side, and 20% was bilateral. So, of course, in a large group, there are patients who could need using this treatment. 2 studies have shown the efficiency of doing neuromuscular stimulation. So we try to have some milestones, and it's not always we reach it, but maybe within a couple of days, try to get the quadriceps activation and try to get the straight knee. Not hyperextension, but zero extension. That's good, and after a couple of weeks, manage to do straight leg raise and flexion to 90 degrees. And we say that if you are going to get rid of the crutches or sticks, you must contract your quadriceps and lift your leg, and don't hang a hanging lift, because then you can't control the way of walking. And as soon as you reach around 100 degrees, you can start on the bike. So most of the patients want to throw away them as soon as possible, but I always say to them, don't do it like this. You have to use them a little bit outside first, then you get rid of them inside, and then you, during a 1 week or for some more, get rid of the crutches. And for the trauma patients, I usually start quite early trying to do the full extension in this standing phase to really see if they can control the knee and the hip in that position. So before they are allowed to throw away the crutches, they must do this exercise well and then continue doing step forward. Then I'm safe that they can do it well. The phase 2, we say that we need to have a physio with a brain turn on. That means actually that we are there, that we are following the patients, we are not having a rest and taking a couple of coffees, but we'll be there together with them in the training room and do and follow them tight so we can individualize the exercises and follow up them closely. And the progression is guided by function, not by time, which you probably also do, even though patients want to know at what time can I do this and what time can I do that. But I say, if you can have full extension, have quadriceps control, glute medius control, then we are talking, then you can do more type of exercises. And usually say 3 months, then you can probably start running. But it depends on the quadriceps control and overfusion, of course. And effusion is the primary indicator that we follow. All the training is controlled by that. And quite early, at least, when they can do this control on the floor, you can go and use these soft pillows and try to do controlled exercises. And then, of course, it's so important to have the hip control. Have the hip-knee toe in line, so we really see that she managed to control it, and it's in very controlled settings. Usually they are doing this in front of a mirror, so they can see themselves that this is the right way of doing it. I have control, and focusing on the right way of doing it, hip-knee toe in line, try to avoid the valgus in valgus position, and try to avoid to get too far ahead with the knees. So, especially with patients with patella graft, some have pain, but that's no pain. So it's important how you show them this. Okay, should we use open or closed kinetic chain exercises? What do you do? Both? Okay. Because open chain exercises have been shown to be of considerable importance for the strength improvement. And it's not that threatening for the graft as we thought 10, 15 years ago, because we didn't, oh no, we are getting to stretch the graft, but that's not true anymore. So we can start quite early by doing leg extension. And muscle strength training, it's more or less fantasy to get all kinds of types of exercise, but squats, I used the leg press a lot. It's very controlled. They can manage quite heavy loads. A lot of hamstrings exercises, for both groups, even if it's hamstrings graft or patella tendon graft, we use a lot of hamstrings exercises because the importance of that muscle. So don't forget hamstrings. And the muscle strength training, do heavy loading when possible. We really push them to do heavy loading. They are really we often talk about, as long as there are no effusion, no problem with the movement. When they can, if they have 4 sets with 12 repetitions, and they could continue to 20, 25 repetitions on the 4th set, then you have to increase the resistance. We include both open and closed chain exercises. We focus about volume and movement. And we try to have a variation of intensity, exercises, and loading modality. And of course, for the reconstruction, you have to have special considerations. And both preoperative and non-operative is really trying to train them hard. So they really are tired after the session. And what about this control training or neuromuscular training? That should be a part of the whole rehab period. and it's often tolerated very early because in small doses. And always try to find a level that it's still difficult for the patient, so they don't manage to do this easily, but it should be a little bit difficult all the time. So what about return to sport? Okay, it should be dynamic stability and functional movements. We have to introduce jumping and landing. For most sports there are jumping and landing, so we have to introduce that. We talk about all the time soft landings with hip and knee flexion, and try to develop muscle power by doing both open and closed kinetic chain exercises, eccentric exercises, and of course the jumping exercises. And this is one way of starting, doing 2-leg jumps. We always start with 2 legs because it's much more controlled, and then they can continue trying to do some 1-leg jumps. But it needs to have good control in the hip and the hip knee toe in line. 1-leg jumps like this, and I like this exercise quite well. It's quite demanding, and we can try that on patient afterwards, because you have to control both the landing and where, how is your hip, how is your core, how is your knee control. Doing quite heavy strength training by also using a weight ball, because you take away some of the consciousness about my knee if you do things like this. Use balls, interrupt all the control. It should be the control thing in the knee and the hip should be automatic. So they are not time to think about how is my knee now. So it should be a really controlled pre-activation, which we all try to achieve. And return to sport. The athletes could be good in all of this stuff, but are they ready to go back to the sport? Probably not. They need to do a lot of time going back to their special sport, start very carefully, and do more and more and more and more time on their special sport, and try, if you have time and the possibility to work with the coaches, I think that's perfect, because then you can really get the rehab in that phase specialized, because probably not all of you have time to go into the field and follow each patient. You are not probably paid for that, but it's important. Then to show you, this is a handball player doing, you can call it a prevention training or a secondary prevention training, but doing a handball specific exercise. See how she is working with a quite heavy rubber band, and for her, a handball player has to do this a lot, and she has to do control, hip knee control training, and this is a fun way of working, and she uses her arm in addition to have these movements with her. This was in Italy, so it's not the way we have it in Norway. So then come back to the functional test that you use before you return to sport, because we need to have some tests to rely on before we return back, and these are the tests that we use. The single hop test. Stand on the. I will try to test that on one of the girls afterwards, and we just measure the hop distance and compare that to the opposite side. And what is really important in this test is that we don't accept any hop. It should be a perfectly landing with control. Otherwise, it's not accepted. A triple crossover hop. You use one leg and jump like this, and you must stand stable and controlled in every landing. But so then we measure the distance again, and the triple hop is just 3 jump on one leg, and again measure the distance and compare it to the opposite side, and then it's the 6-meter time hop, and then they are jumping 6 meters, we time them to see how long time they use on the two different legs. And they should, and these home tests have been tested for validity, and they are reported to be valid as a functional performance measurement to detect lower limb asymmetries in adult individuals after the injury or reconstruction. This is more detail about the correlations, and two studies that has been done looking at first one group of non-reconstructed and the other one on the reconstructed group. And the leg symmetry index is a single of the single hop test distance can significantly predict self-reported knee function 1 year after treated injured individuals. So if they do well on a jump test, and if they are not reconstructed, you can do this after 2-3 months. On the reconstructed, you have to wait for 6 months. So among the reconstructed patients, it's also can predict the self-reported knee function 1 year after the treatment. This is for the reconstruction. You can see here they function well about the successful outcome 1 year after. So it's a good test to use, I think. It gives us a little bit more numbers about if they are going back to sport or not. And the criteria, they are really much discussed around, but in one study they have summed up that the muscle strength measurement should be 90% or more than the opposite leg when you are testing isokinetically. The singular hop test the same, 90% or more on the opposite leg, and again with stability and quality of the movements. And you need to have performed gradual increase in sport-specific training. So they can't just go back and know I play. Of course, depends on what kind of sport. But if there are jumping, turning, cutting movements, you really need time on that rehab. And most of us, in Norway, we say between 9 and 12 months you return to your sport. And I suppose that's the same that you have here. So we probably agree on that. And regarding secondary prevention, I think it's about the load management. You can't put people back to the sport and doing a lot of sport-specific training and don't have time to do the strength and neuromuscular training. You have to have time to do that. So it had to be a slowly increase in amount of training, sport-specific training, but don't stop doing the strength and neuromuscular training. And of course, perform the activities. That's where the goal of the rehabilitation. Yeah. So for ACLs, remove fusion, regain full active extension, initiate the movement early, make the rehabilitation individualized, make sure you have an active interdisciplinary collaboration, and this is the assessment that we use. Use the four-leg hop test, do isokinetic testing if we have it available, use IKDC or QS, and use time on the rehab, especially the return to sport rehab. And of course, patients have to be patient because it takes time to really get good. So I think we have to use a lot of our time to work with that. And maybe also honesty, because if a person has an increased risk of getting a re-injury, should they go back for every reason? I think we need to consider this and advise the patient accordingly to that. We have to be honest, and they make their own choice. I think we need to be aware of that. Because a lot of sports have a really high re-rupture rates for the same on the opposite side. So use time on that discussion as well. And we have to ask ourselves this return to sport always. I think that's difficult because we have a lot of 16, 17 girls playing handball and soccer, and they want to go back. They really want. But then we have to do the work to get them as good as possible and stronger and more stable than ever. So when they go back, they do a lot of right training and prevention training. And for a girl like this, which was my patient, she was 15 years old, playing both handball and football, I think she needs to be well informed. She needs to have strength, the best as possible neuromuscular control. Her endurance should be good enough. And if we can have some risk factor reductions, which in her case, playing handball, I have to try to teach her how to do the cutting, how to do the landing. Because if you teach them to them in a better way, a safer way, that's a good way of working. Do technique change if that is necessary. Work with the coach, tell the coach. Do the functional tests. Are they psychologically prepared? Are they afraid? If you're afraid going out doing a cutting movement, they have nothing to do there. They need to be safe. And of course, do the sport-specific prevention program throughout there, which I will talk more about tomorrow and Wednesday. And finally, I just want to tell you about this app, because we have these days released a new app to the Youth Olympic Games in Nanjing, and we have made an app which is called Get Set, and it's free for everyone. So go in the App Store, and in that app you will have exercises for all the Olympic summer sports that are there. And we have put in videos of exercise programs for all these areas: shoulder, back, groin, hamstring, knee, and ankle. So they are, as long as there are scientific evidence of prevention exercises that work, they are there. So you can see all the exercises that we know work in different sports. So we can choose ankle, and you have 3 levels of difficulty. So just that you know that it's possible to have an easy access. Give it to your patient. They are in English, French, Chinese, Spanish, and soon Norwegian. But for you, I think it's perfect right now. So give it to your patients. Now we'll ask you please tell about the app to all these patients and the parents, all the coaches, easy access. So I think with that I say thank you for this part, and if you have questions, let me know.
As regards to that.
If you have a range of motion, no infusion, good body sense control, I say that you can start in 2 minutes, and if you have no problem after 2 minutes running, you during 6 weeks can increase to 20 minutes. So you use long time, maximum two times a week, and we follow them. If you have any problem, any pain, stop running, go back to the bike, and of course a lot of biking all the time. They can have long, up to 1 hour on the bike, but really go slowly with the running. And by someone I say, okay, you have to wait. I'm not satisfied with the progression of your muscles, so they wait maybe to 4 months, and then they can increase a little bit quicker. But if they start at 3 months, wait. So that's the way we do it. And I always say to the patient that you will stop running if everything is okay between 3 and 4 months, because then I have this slack. So if so they are happy if they can start after 3 months, and it's okay after 3.5 months as well. And it also depends on sport they play. So it's the same the way you do next time, you know?
Yeah.
Because slowly running should be okay.
I think the difference is relaying to the patients the amount of time is actually very small to start with. Because patients think running is automatically. I usually run 5 kilometres.
Yeah, it's 2 minutes.
Yeah.
So they understand.
Do you use walk, run, or any variation like that?
I start on the treadmill. If it's a patellograph, you start with a little bit uphill. If it's hamstring, I ordinarily flat, and 7 kilometers per hour is very slow. So you can almost go very fast, but you can, I say, go fast for 5-10 minutes, then slowly 2 minutes, and then go again. And then they do maybe 2 minutes more the next time. Everything is okay.
So you increase the intervals. So
but they are happy. I mean, 2 minutes we're running and they are, yes, this is fantastic. So if you're not allowed to run, it's always fantastic.
Do you always have a chance to observe them playing their sports, just in the case of injury prevention? I find it that it's challenging to give them advice on injury prevention when they're telling me something about their training is not right, and I'm inferring from what they're telling me as opposed to seeing them.
Well, you know, at the Olympic Center, at the best athlete, we have the possibility, but most of my patients are ordinary playing at different levels. They are youth athletes, really promising and good, but what I try to do is to use the training room and do handball or soccer exercises as close as possible to what they do on the field. So I can see what they are doing and make them really clear in their mind what I think is a good way of doing it and what is not a good way of doing it. So I have trouble giving out and looking at that. But if we have time to talk with the coaches, of course it's okay. And I sometimes send them a message, you're allowed to do this, this and this, but not this. So really get hard on that.
Okay, we'll go through and have a look at the two patients that have very generously with them. So Kyla is 3 months approximately from her surgery. She had a patella tendon graft for an ACL injury that occurred playing soccer. I got that right?
Yeah.
It's,
And I asked Carla, how did it happen? Can you tell her?
During my soccer game, I was just running and my knee just gave out and went out and then just popped and that was it.
So just running is quite special in a way because often there are some kind of turning or change direction, but not for you.
No.
Lie down on your back. And just test the movement and the stability. Then up a little bit. There you are. So first,
It's okay.
first I just examine her right knee and just look at if there are any fusion in the left, and it looks quite good. And I try to see what's normal extension for Carla. Got that in flexion. Good. No trouble with this one? So I go quite directly now. I don't do all the, all the talk and all everything. You don't have time for that. And try to relax and test the stability, which is good. And look at this. When we see her, the extension is really good. It's really good to see that her extension is what it should be. She has a little bit more hyperextension on the right, but I think this is perfect in my mind. Perfect. Flex this knee, lift it up. Just flex it. There you are. Is this okay? Mm-hmm. Put the other way up as well. Put this up. Then we can compare. And you said that you think that the flexion was not good enough.
There's some pain in the back when it flexes all the way.
But you have actually full range of motion. But I think don't push the flexion because that will be okay.
Yeah.
It's only 3 months. And I also would like to just test the Lachman. Really good, tight and very good. So here, someone has done a good job. Is it you?
no,
It's not you. Okay.
you can say anything you want now.
Well, otherwise I have to be very careful, of course. He's my host, so he's taking care of me the rest of the day, so it's important to be careful. Just test the hip rotation. It's good. Let's see. And you have a patella tendon graft. Mm-hmm. And Bruce, can you tell me why they choose that instead of a hamstring? Is that the surgeon or is it the sport?
I think specifically in this case it was related to the age of the patient, and the physes were closed, but it was felt that in a patient of a younger age there's some evidence to suggest patella tendon may be.
Because I think the trend in Norway is that by handball and soccer girls getting patella tendon or quadriceps
Then
And we have about 4 times as high division rates in hamstrings compared to in young girls.
so more and more of the girls are getting patellar tendon and quadriceps actually, which works well.
We change it to whether how much jumping they're going to be doing too. We find the quads and patellar tendon patients struggle more going back to, whereas change of direction sports, in a younger patient, we tend to use a patellar tendon. We kind of modify things a little bit.
Because and they also say that you know the problem with the patellofemoral pain if you use the patellar tendon, but I think it depends on the rehab. You can keep it quite low, and I use also a lot of myconal taping of those who have problem with it, so that helps a lot. Let me see your quadriceps. Yes, come up there as well. And we can see that she's starting to get really good muscles, but there are a difference. So if I had measured this, it would be a couple of centimeters difference probably. But it's a really good start, I will say. So now I just want to see what you can do. So if you stand up, you can stand really here. And you can use the mirror there.
Okay.
And if I ask you to do a squat with 2 legs, squat. Couple of more. Just continue. How does this feel to do this?
There's some pain on the kneecap, but other than that, it feels fine.
So a little bit patellofemoral pain. Yeah. But I think you do it perfect. You have the hip, knee, toe in line. No valgus, you know, not these kissing knees that we also call it.
Yeah.
No kissing knees. So I think it looks good. If I ask you to do a 1-leg squat on your right, just very slowly and not so deep. One more. Good. And the left. Have you done that a lot? You have started with that? Okay. How deep are you managing to go? Can you go deeper? Is it pain or is it you're not strong enough maybe?
I think it's a little bit of both because I feel some pain on the kneecap with this one too.
So often if this continue, I try the myconal taping to lift up the apex a little bit, so it takes away. But that was not used.
Okay.
Let me see if you can just stand like this and do these movements. Okay, and I want you to keep a little bit flexion in your knee when you're going over. So you keep this flexion there. Yeah? Have you done any jumping?
A little bit of landing.
What kind of jumping have you been doing?
I've just been like standing on a box and then landing.
Landing, yeah? So if I asked you to try, when you do this now, to just a very, very small jump like this. We are a little bit, yeah? So, good. Good hip control, because the main thing here, it's this part. She needs to have hip control. She needs to continue to have the hip, knee, toe in line in all kinds of exercises that she's doing. I use that a lot and control for that, but you are really good. You have a good PT or athletic trainer. I don't know what you are using. Maybe both. Yeah. So I think I would make it a little bit more difficult for you because this is too easy. So
Okay.
do a little bit more. Can you give me the blue? So now I want you to stand like this, and first you can do it with the right knee. Go there, and you are going to keep the knee in this position. So you're not straighten up, you're going to keep it a little bit flexion with the right knee first.
Just balance on it?
And go back again, like you're going a step in. And then you can do the left. And the hands here. You're not allowed to help with your hands. A little bit more difficult on the left.
Yeah. some balance issues.
That's the whole point. Okay, I always try to get these muscles awake all the time, not allowed to get to sleep. Then you can do the same, but now we are coming from that side and going into the... Good. Oops, what happens there?
I didn't get all of my balance over.
No, what happens then is that your hip is going like this.
Oh, yeah.
So always be control there. Try
Okay.
again. And a little bit longer.
Okay.
Make it more difficult. Come on. There, good. And again. Very good. And come again. Come again. And now you are naturally safing a little bit. So you wait a little bit before you lift this. Try to go and...
Okay.
Come on, control. And control, come on. Yes. Oh. You see it? The little bit. I don't want any hip dancing. Not today. And over again. Come on, control. And if you think it's difficult, try to activate your stomach, the lower part.
Okay.
Come in. Good. Good. And back again. And then you can try it in this position, like this one. So you're going like this. Oops. So this is a little bit more difficult. You can feel that? Because now we are working more with... That is better. Good. Good. One more. You have one more blue Garricks. Good. Now, make it a little bit more difficult again.
Okay.
So, side to side. Like this. Control. Control all the time. Okay, and now I want you to have some variation in the flexion in your knee. Because now we have the same position all the time, but you can have it a little bit straighter and a little bit deeper. So we have variation. Yeah, good. Very good. Control, 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 good. Tell me if you're getting tired. Not tired?
No.
That's good. Stop. You go there. Again. This time. Oops. There again. You're maybe not allowed to do this. In Norway we do this. Or am I allowed to do it?
Yeah.
Yes, good. You can manage that?
Sign the form.
I haven't done that. Good. I try to keep the position more when you land there.
Okay.
Keep it there. And back. Keep it there. Control. Okay, relax. Very good.
Thank
So
you.
this is some way, I think, to make the exercises more and more difficult all the time. Because she is so good, I have to give it more and more. And of course I would like to try the booster. See how that is. Okay, first I want you to do a squat on the booster, like this. And you can keep your hand here so you can go up like, I want you to go up like this. And think control. You have going to have a squat in this position, up and down. Okay? But just use me to stabilize. Put it in middle first. There you are.
Never used this before.
No?
No.
Fun with something new.
Yeah.
First thing, try to have control now. Don't do so much, just find the balance. Is it scary?
All right.
It's okay? And then you should try a mini squat. Good. Straight up there, yes, good. And in this position, I think it's important to get full extension. To go up and have control when you are up. Close down, down again. And you know, I want you to use the same, use your both legs the same way.
Okay.
Don't go with the weight over here.
Okay.
Okay. A little bit shaking Stevens there. That's okay. A little bit deeper now. Come on, come on, come on, come on, come on. And up again. And it's perfect when it's like this because you get a lot of stimulation. So it's okay.
Okay.
Try, keep your hands here. Okay, try again. Go down, 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 down. Oh, come, come. Oh, good. Up again. It's good. Down again. Very good. One more. Good. Okay. Now you are going to go careful down. So perfect. Perfect. Very good. And you know, it's a lot of ways to use this one. I can show it a little bit afterwards, but have you done, you call this lunges? Is that the right way to say it?
Yeah.
Lunge.
No, if I call it lunge, and that's wrong. Lunges.
Lunges.
It's almost like lunge,
Yeah.
but it's difficult. Are we going to eat or what are we going to do? Okay, lunges. Can you take one lunge without this, just on the floor?
Okay.
That means you have done that? Good. And back again. One more. It's very nice and controlled. It's very good. Good hip control. Hip knee toe in line. And now I'll see if you can do it on this one. And now I want more and more that the weeks to come, I would say, now you are going down, control down. I want it to be a movement that is like this, with power. There and push. But you can't do all this the first day, so you have to use time to reach that. But have more power, a little bit more push on this exercise, and it is a really good exercise for you.
Yeah.
The step, can I have one of that? No, I just try to show a lot of exercise. Is that okay? You don't do everything from one day, but this one. Thank you. You're done step up and step down? Or
I think so.
yeah?
Yeah.
Try to go up on your left knee. Okay, and down. Okay, then we change it again. Now, when you are going up, you're going a little bit closer with this, and then you lift up your toe, and then lift up. Because otherwise you will use your right leg. So up with a little bit closer with this. This one is better, and lift up your toes on that.
On this one?
Yeah, up, up. What happens if you lift up the toes here? You're not allowed to use this leg. That's the point. So
Yeah.
now you really have to use all your muscles there.
Mm-hmm.
Try to lift you up. Up with the toes. Good. And slowly down, slowly down. Good. Try to avoid the knee getting inside.
Okay.
Okay, up again. Come on. Good. Slowly down. A little bit. You see, you're
Yeah, I
working
saw that.
hard with this. But then it's a good exercise for you because you really have to concentrate.
Yeah.
And no position. No hip out. Hip, knee, toe. This is the line I want you always to have. So if you think this is the middle of your hip, you are going to have a line straight over your scarf and down to the middle of your foot.
Okay.
And that should you keep all the time. Also when you start playing football. And this is going to be more difficult if you do like this. And you do the same. Go up now. Now we are allowed to use the other one a little bit. Try to get up. And slowly down. And it's more difficult, of course. And when this is too easy again, I will show you. Because maybe too early for you all of this in one day. But when you get up like this and maybe even higher, you can go up like this. And in one movement, go up like this. It makes a lot of balance, and I focus a lot about stretching the hip and knee in addition to going up there. You get a lot of movements in the same place.
Okay.
Jumping. Show me what you have been doing.
I've really just been doing landing, so I haven't worked on the full extension yet.
Mm-hmm. Just this one or
Yeah.
something like that. Perfect. Very good landing. Soft landing on your toes with flexion in hip and knees. Very good. You have a good physio. Very good. Very, very good. So that's good.
Okay.
Could you, if you now go down, would you back and forth? Can you look in the mirror? Mm-hmm. Take 5 seconds in a row. Keep knee toe in line, soft landings. You feel it?
Yeah.
Pain or just tired?
Mostly tired, some pain in the kneecap again, but not bad.
No. No, I haven't actually examined her kneecap and everything, so I just jumped over all that stuff. If there might be some muscle problem, that she's tight in her muscles, then I work with that. And if I had felt that she had a problem from the HOFA, the office fat pad, or the apex is going into the fat pad, I would try to give you some taping. But I think that physios probably following that in a good way. So when you are 3 months ahead, I think you are following your schedule very well, and you really need to use a lot of time doing strength training. So maybe you should go to if you come here like just now and then, you probably go to a gym and get some things like that, a leg press. Have you used that?
Yeah.
Can you show me how to do it? Can you just do that? So, what is the time, Bruce? And
1 o'clock, just 1.
So it's okay?
Yeah.
Check that.
You guys okay?
Yeah. Hold on. Have you been doing it?
Usually
Try that.
usually come on one leg.
Perfect. Eccentric loading is very good. And what we often see, if she does like this, she can have really heavy loads when you push out, because you can manage heavy loads when you go in the eccentric phase. And it's perfect. You have this hip knee toe in line. It's very good. I like that. And you stop there, yeah, and have control. And you should start. It should be really heavy. How many repetitions do you have?
I usually do 3 sets of 10.
Mm-hmm. So I also say you can do 3 sets with this way of doing it, and a couple of sets with both legs. And I want you to really get, it should be so heavy now, that if you don't have any pain here, when you have done the 10 last one, in the third set, and if you can continue taking 5 or 10 more, you have to increase the load.
Okay.
It should be really heavy.
Juliet has started jogging yet?
Have you done that?
Yeah.
How does that work?
I usually do 2 minutes jogging and then 1 minute walking for 10 to 15 minutes.
Well, seems to be wise. And no pain after that?
No, not really.
No? Good. You shouldn't have pain.
Yeah.
So. But I think what you need now is just to continue with really hard training, 6 to 12 months more. You really continue doing hard training.
Okay.
And for the soccer thing, you should ask your coach to load, get set. There is the prevention program for girls at your age. If they do this prevention program as a warm-up, you have a 50% reduction in getting lower extremity injuries. And that's why I tell every coach, I can't understand why you don't do it. Can you afford half of your squat getting injured in one or other way? So coach should be responsible for what they are doing, and then they should use the preventing exercises program that's out there and works. They really works. So even though coaches love to do their own warm-up, force them to do the 11 plus, which is the name of it, actually. And
That's what's on the kit set, is it?
Yeah.
11 plus?
Yeah.
Okay.
It's all the exercises are there. And I think you should go into that Get Set, the app, load the app, and look at football, which stands football there. Because football is the Olympic sport, which is called soccer here, but football, and then you will see how to avoid knee injury.
Okay.
So we'll find a lot of exercises which is really good for you when you're starting to come back, but it's a little bit easy early on. I wonder if there are things I forgot, because it's too early to do a more explosive leg exercise, so I will think I will use that with you. So I think I'd say thank you very much.
Thank you.
You are beautiful and you will be so good. Just train really hard. 3 times a week you should be to do this kind of program.
Okay.
And use this. I haven't shown you any hamstrings exercises, but I can do that with her because I use a lot of hamstrings. So we can, if you sit there, you can see some exercises that I can do. Good. Take this one.
So Emma is the next patient. She's at 6 months, 5 and a bit months from having a hamstring ACL reconstruction. She had some medial and lateral meniscus surgery as well. She's a competitive gymnast. That's what she's interested in. And so she's showing the next phase of the rehab.
We have talked already. Come up here. I have to see her range of motion, so usually I test them standing and talk with them and do all this stuff, but now we go directly. It's okay? And I need to see your knee, so we have to take it. Okay, do you have any problem?
Not really.
And you started doing your gymnastic exercises, and that's quite tough things, isn't it?
Yeah.
Mm-hmm. Do you have any pain or problem?
Sometimes, mostly in the actual hamstring where it was grafted from.
Mm-hmm.
And then on the inside of the knee, medially, I think.
Yeah. Good.
It feels really like hard and tight,
Mm-hmm.
and whenever I do anything, it just like feels like it's pulling.
Mm-hmm. On the other side as well. No pain here? It's okay. Come a little bit out. Just move you. Good. Seems to be stable and good. No problem with the ligaments. Okay. You see here she has a good rotation. Something with the sport maybe. And the extension is just the same as the other side. Good. The flexion, go in, both in. Seems to be good. Any problem? No, it's okay. Good. It's very good. No pain when I do this. And if you let me see your muscles, like that, up there, and then same here. Have you been testing the muscle strength and?
A little bit.
Yeah.
I can definitely tell this one's stronger.
Yeah. You can see that there's still some atrophy, but I think that's normal after six months, so nothing new with that. I would love to have a isokinetic test to see how much difference is between the 2 legs in quadriceps and hamstrings, and see if she has really 90%, and probably of the opposite, if this have almost the same strength as this, because the goal is to be as strong as this. And what we know happens is that the right one is getting stronger also, so it's hard work to get the muscles really get strong enough, as strong as this one. Do you do a lot of one leg exercises?
Yeah.
To try to improve it? Leg extension is this, you have it here? No, this is something?
We don't have one.
Huh? Don't have it?
Yeah.
No. Okay, up, I will see you do some work. Maybe we should just take this away?
Sure.
Yeah, we can do that. This one? And what I want to show me is what you have been doing of jumping exercises.
We just do jumping side to side, forward, up on the bigger blocks, down from the bigger blocks, going forward, sideways, and like transversal plane and things like that.
Can you just demonstrate them? So you have been told to start there and go into flexion.
Yeah, to come here.
Okay. If you try to now have the same flexion in your knee all the time when you go over, don't just keep that flexion up and over again. And just less flexion, a little bit stiff area. Keep working there, and try to jump in that position. And if you're what do you call this? Going on skøyter, var det, Lars? Huh?
Lateral?
No, you're going on ice like this.
Oh, skating.
Skating, thank you. If you're a skater, show me what you will do then. More like this. And this. Come on. Okay. I don't want you to get, don't want this, because then the hip is getting out. So,
Okay.
here,
Okay.
here. Long jumps. Come on, come on. Where's your leg? Don't want it back there, it's better. Good. 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 Good control. You see, you have a little bit control like that. Then I want it to be like this. And the other way around, turn right leg in front. Is it more scary to go back with that? It's okay?
It's the same.
Feel safe? And in your sport, do you have most two legs landing or?
2 leg.
Yeah, always two legs. So you do a lot of practice on landing on two legs.
Yeah.
That's good. And you manage to do that when you are you doing all this?
Yeah.
That's well. All that is.
Flipping.
Yeah. And no problem.
I haven't done any flipping or
No.
anything like that.
What's the toughest thing you have done now?
Backflips. Landing.
Like this?
Yeah.
But not since you were, have you done it since you were?
I've done when I put my hands on the ground, but not like just flipping.
Not like this?
Backwards. But I put my hands on the ground. Yeah.
It sounds pretty tough, but it's probably natural for you to do that.
Yeah.
I would like to see on these two full balls. Over here, try to jump and have control.
Maybe. We'll see.
Yeah, just try. I think you will have that. Remember your leg. Good. Good. Fine, and then we should try that. You stand like this. I don't manage to do it, but like this. Right.
Right.
It's like you're skiing, telemark skiing, but it's not maybe not used here.
So skilled. Okay.
Good. Control, hip, knee, toe in control all the time. Does it look good?
Pretty good.
Mm-hmm. And you feel you have to work a lot with your muscles, or is it easy?
It's kind of easy, but on the other hand, it's like side to side a lot.
Yeah.
Yeah.
So you got a lot of control training here. That's good for you. Okay, let's. I'll show one exercise here. To get a little bit tougher training, I want you to. It's the.
Left.
I want you to sit like this. So you have to pushing, and you have to take the load back and slow it down. Control the load when it's coming back. That's it?
Alright. Yeah, baby. Okay.
Then, of course, you have done a lot of
Pushing.
with this. You have used this exercise?
Never.
Never? Okay. Then I wouldn't stop with that. Put your legs higher up. There. Hip, knee, toe in line.
Mhm.
Always try just to do one normal press of that. Slowly back. It's too easy for you, isn't it? You should go a little bit closer. Where's the? There it is. Want to come closer? Isn't it this? Oh, there it is. There you are. Then you can put this down. 2 seconds.
Sit down two.
Yeah.
Like that.
Yeah.
Yeah.
And you
Sure.
just now.
Sorry.
Right.
Sorry.
Okay, come again. And then you only use this in the return. Close slowly back. And off again. You can keep the leg here, but you don't use it. Now you're only using this. Is this heavy or is it? Okay.
It's okay.
Is it 40 kilos and 90? It's kilos and pounds. Yeah. Mm. So you haven't done anything of this.
I've never used this before.
Do you have access for this type of machine? You don't go to a gym?
I stay at my gym, but it's not. It's a.
They don't have this?
Mm-mm. It doesn't look like this.
No. But okay. It could be a good way of increasing your muscle, because it's very controlled and you can have heavy loads. Because doing one leg squats, you can't have these heavy loads. It's more difficult. There you can really go hard on the resistance, so you really can work hard with this. You feel you're working good?
Mm-hmm.
I would have increased the load quite quick, because she's strong enough to have it heavier. But since you have hamstrings, I would try to show you some hamstrings exercises.
Okay.
You can come now. What kind of exercises do you use for this muscle group?
We do lots of squats
Yeah?
and things, but
No special. Okay,
No.
then it's okay to show you some. Okay, just. If you lay down, you go back. There. Just like. The legs there. This. And if you now lift up this part and get the ball inside like this, and slowly out. Now you really have to work with your core stability. Right. Do you think this is quite easy?
yeah, I've done this before.
Then, yeah. Have you done it with only one leg?
Yeah.
Yeah, let's show me that as well.
Which one?
The injured one. Mhm. Keep that position. That's heavier. Mhm. Good. Good. Then you can come up. Carl Aspling's exercises. It's a Swedish PT doing his PhD on hamstrings. And there's a lot of good exercises. That I have his article.
Is that the one from the British Journal of Sports?
Yep.
Yeah, I think it's all,
Yeah.
I know the one you mean where they compared it to the.
Yeah, two different types of exercise. Yeah. So the first one is called the diver. So you are thinking you are diving into the sea, but there are no sea. So you stand on this injured leg with a little bit flexion in the knee. You can keep something in your hand, or you can just stretch your arms. The other leg is flexed like this. You go ahead like this, and you get up by using the hamstrings. Far ahead, and up again. And then you work a lot with the control in the knee and hip, and in addition, you work hard with the hamstrings. Would you try?
Sure.
Think you are going to dive into the ocean, and this is kept in this position, and you are going to keep this position all the time. So straight ahead now, far ahead, and then get up and use these muscles here. Go ahead. Again. And I want you to feel that you are working with your hamstrings. So far ahead there, and up again. Take some more. Control here. Are you feeling that there's something happening up there? Not so much?
Kinda, but it's mostly in like my quad and butt, like in the back.
Try without the ball, and now stretch even further ahead. Like there, and up again. Because you also a lot of motion. Control in the knee. Very good. You could do 3 sets with this, with 10. You probably will be really tired in your hamstrings after a while. Good. Try to relax. Okay. And you also do use a lot of this stuff with hamstrings training. Have you tried that? How can we get this down? Because I want you to, maybe it's a little bit too hard. Okay. I want you to try to put your leg into this, lie your head there, and in your knee. You are going down first, lying on your back. So leg in there. See if it's okay. Yep. And actually, we should have both, but it's getting too short. We should have both legs. You have to think this is both legs.
What I would do is switch this way too.
Yeah,
More
you fix
facing
it.
this
I don't
direction.
know this.
So switch around this way so you're going that way.
Well, you can get on here. Good.
I'm not sure where you're going with this, but. So lie back like that.
Up with that.
Bridge your hips up. You do just like you do on the ball. You do one at a time. Whatever. Sorry.
Yeah, they're good. Up with your this one, and get your legs into flexion. Would rather have her feet through this because now she's using the legs too much in this position. So
Okay.
the feet should be inside. I don't know if it's possible. Yeah, it's okay. Now try to relax in your feet. Get up here and try to flex your knees, both knees into your head as far as you can, as long as. This is also a way of working with the hamstrings, and it's also unstable, so you get a lot of work in the rest of the body. Work with this. Keep that stomach. Can you feel you're working a little bit now? If you try now only with the injured one, try to let the other one relax.
do one.
Yeah. Further in. There you go. You're up. So it should have been a little bit slower down. But it's a way of getting the hamstrings activated in many different ways. And he also, Swedish guy also have a very nice sliding exercise, but you need to have a slide board. That you
Yeah,
can
we have
slide.
one here.
Yeah. So it's a good exercise. You want to try it if you want. You can slow down. This out. You have the slide board, and
Yeah, Rob's grabbed that.
if you want to see it, it's quite heavy. And we need to have this on it. It's a left.
Left.
Yeah. Yeah, do it there. And then you have to take the shoe off.
On the
Only
side?
the healthy one. Shoe off.
Take that healthy.
Both is
Healthy shoe.
See if I can manage to do it. The point is that you are going back here with eccentric load, and then you use your hands to go up and go down again. So this is the way one I'm working with, but I don't want to concentrically get up with this. So it's actually the difference, but you can turn around like this. Because
Am I sliding this?
yeah, this is running,
Okay.
this is working. The right one is working. So, sliding back, maybe too short now. And use your hands here to get ahead. You slide back again. So, I can put this a little bit forward. Slide more, longer back. So we really feel that you work with this, and then you use your hand. Don't use your arms when you're going back. Straight, not so flexed. There you are. Now you're using your arm, you're going back that way. So you keep your arm there. And use your arm to push.
Okay.
Yeah.
Right.
So now you don't use your arms, but now you do it to get. Now you are going to use the hamstrings on the left side. It's really hard eccentric exercise. But I can show you the article, it's easier to see the videos also there. Okay? So this is the Askling exercises for hamstrings, which are really hard and works well in rehab. And it's good to use for those with a hamstring graft especially. Okay, let me think if there are, yeah, I think we will end up with the functional tests. Okay, before we turn to sport, I think we need to have some tests to see how well is her reconstructed knee compared to the other one. Then we go back to the jumping exercises. So then we need to measure the length.
It's a tape issue.
Yeah, let's go there. Yes, good. You keep it there. Do you have a tape so we can?
You can just lock it.
Yeah, I can maybe lock it there. Yeah, good.
We're jumping around.
Now we are jumping. So
So
after 6 months, this is a typical test that the athlete should do. If everything is gone well, the function, no effusion, range of motion, everything is okay, you must jump it. This is the,
This is ACL.
yeah.
Mm-hmm.
And when you're doing this one, you start with the one who is not been reconstructed, and test how long you can jump. So we are standing on your right knee, right leg. You are allowed to use your arms, and you go to jump and land and be stable in the landing. I want you to jump as long as you can.
Okay.
But the landing has to be stable. You can't do like this and help yourself. You're going to land on one leg with control. Come a little bit closer. You're not seeing anything over there. Okay, try with the right knee. So this is the healthy or the non-reconstructed one. Up with this, and you're allowed to use your arms to jump and be standing still when you land. Just try once. Okay, it's not bad. And you have to stand on the stand still, not the extra landing.
Okay.
So go back once more. Try once more. You are allowed to use your arms if you want. And be standing there. Good. Okay. This is the how you can go. How long is it? Yeah. So this is one more. Same. So you have three trials on the right. Good. That's longer. Perfect. It's okay from that side as well. You're satisfied with the landing. And one more. Even better. You ready? Now we want to see how we are jumping on the left. And it's important that you are going to feel safe. You are doing the best you can, but you have to have a nice landing. Okay? Just have one trial first if you want. Okay. One more. We don't. This is try. Good. Okay, one more. Good. Good landing. Seems to be good. And one more, just for comparing. So she needs to have a good landing with control. Very good. Okay. So then we compare the best results and see the length between those and see how much is this 90% or is it maybe 80% or the opposite. Then we know that the one leg is not good enough yet. Then you're going to have 3 jumps. Okay? Try. Start. You can have only 2 with the right now.
Do 2 jumps?
Yeah, no, we are going to have, I'm not going to show you because mine is so bad, but 1, 2, 3, and try to stand on the last one.
Am I jumping as far as I can, or just like
As far as you can and as quick as you can, but with control. Very good. One more. Whoa, what happened now? Not afraid anymore? Yeah, I will say that too. Okay, then you want to try the other one?
See, as a new sport.
Yeah.
Accepted that one. Have one more. Control there. So control all the time. Good landing. Hip knee toe in line. No. We can already say that there's some difference in the length. Do you want to try once more? Yeah, do that on the left. So now it's maybe one week. Much better. But even though, quite a distance between. So this tells me that we have something we have to work with. The control, and you have a jumping sport, so of course you need to be really good at this. Be stronger, more explosion, more control. That's so important. maybe is most difficult. Then you are going to stand like this and hop. Okay, 3 jumps, crossover. And again, it should be as long as possible. 3 landings, so 1, 2, 3, and stand. Behind the... no cheating here. Okay, we have to one more, because we have this extra jump. So we see when we do this more, like this is more difficult, and then they jump shorter and working harder to control it. Try again. Yep. And then one more. Okay, we can take the left now. Better? Yeah, almost the same. One more. It seems to be that you have more to go in on the right one there, because I don't think you took all that you have. Once more. The way it is. Will be good. Okay, good. Okay, maybe about 40 centimeters. But do you feel safe when you do this?
Yeah.
You feel stable?
Yeah.
You are not afraid?
No.
No. But you see that you have some distance to go?
Oh yeah.
Yeah. So
Have you done much of this before?
Yeah. Lots of. We jump forwards, sideways, and then like into the transfers. So.
And the last test is that we let you jump 6 seconds and see how far you can jump. Should we try that as well? Someone who can take the time?
How much length will we need?
I don't know, maybe you can start over here. Around here, maybe, I think. And then you start.
I'm running?
No, jumping as fast as you can on one leg, and we take the time and say stop when you're going to stop. And don't think about stopping then. You just we don't just measure. Yeah, you have to stop when you say stop.
When you guys say stop.
Yeah, 6 seconds. How far can you jump?
Am I on each jump? Am I jumping as far as I can, or just as fast?
The way you want. But
You can go anyway. It's just
Okay. It's just like okay. All
You're
right.
just jumping in 6 seconds.
Ready?
Okay.
Start. All right.
What do you call that when you start a little bit early?
Yeah. I'll tell you when to start, okay?
Okay.
Ready? Start.
Oh. 6, it wasn't...
6.
Okay, too short. But you see the point? Having just time the number of meters for 6 seconds, because then you have a little bit the time and also how quick you are going to do this, fast. So I think you need a lot of jumping, a lot of strength training in both quadriceps and hamstrings to get even better, because you are really good. But if we had measured the percent of the opposite side, I don't think you will have 90%. You see that there are too much differences. So for you, this is also a test you can practice actually to see how far you can come and get it as close as possible. And if we had taken an isokinetic test as well,
Yeah.
I probably will have found 20-25% difference between the sides, the hamstrings and quadriceps. And then I say you are not allowed to do going to competition. You have to do the practice for a long time before you really do competition. In my mind, that is right. I don't know what you think about that. What is your opinion about that?
Sure, I think it's
6 months only, so
after 6 months is the beginning of
Yeah.
when you can test them, and often it takes till 9 months before
yeah.
that.
So you probably need at least 3 months with a lot of training, a lot of strength, balance, jumping, in addition to the sport that you love. But you must not drop doing the strength and balance and coordination.
And the single legs, because your other leg is getting stronger too.
Yeah, it does.
And it's got to catch up.
So it's important to do the one leg. And the one I showed you with just doing one leg with explosion in the leg press is a good exercise, but you probably need to do this more in a regular way first.
Very good.
I probably forgot a lot, but questions, or how would you test a girl like her? Is this the test that you would include in your lecture? And of course, you should have some more specific for your sport, but we don't have that. Lars, do you have any comments?
Oh, we just have to do gymnastics, right?
Mm.
We have to build in a couple of tests that are geared towards that particular sport. Norway is not particularly good in
No.
gymnastics, so we don't really have.
We don't have
big
tests for that.
But it should involve, you have 4 tests there, or 6 tests maybe. You add 2 more,
Yeah.
which is more specific for gymnastics. For the floor part of the gymnastics, which is the worst
So you're doing all this.
Yeah, landing off the bar and then landing off the box.
Yeah. Questions? You probably do all these things yourself, so it's nothing new, but it's all we
No,
need
it's
to know.
very good.
Good to know that we're doing the same things.
Well, very grateful for you and very grateful for the patients.
Thank you.
And they have the app now for their phone, so they're happy.
Well, good luck with the rehab. Really hope it will be really good. Both
Okay,
of you.
once again for Greta, thank you
Okay.
for the time. Okay, very good. Well, we'll see some of you at the lecture tomorrow night, and we'll learn some more about what these people know. We're going to milk everything out of them while they're
And remember, get set. It's
Yeah.
Get set.
It's actually the first edition of it, so we
Yeah,
are going to
it will be
develop
new.
it further. It's only for summer sports. There's going to be one for winter as well. Maybe even rugby will be in there. So it will be developed over the next few
Then we need
years.
some help.
Yeah, that's right. It's a reason for me to come to Norway.
Yeah. That's good.
Excellent. Okay, thank you.
Thank you.